I'm pleased to welcome Antoniette Holt to Gleaners Food Bank. Antoinette, you're one of two Indiana Department of Health employees we're talking to over the course of this series. And we learned a little bit about SNAP education in another segment, and would love to learn more from you in terms of overall policy and programs and ways that we might collaborate as well. But can you start by sharing a little bit about your role and areas of responsibility, and then maybe take that on to ways that we do or could work together in hunger relief as well?
Sure. Thank you for having me here today. So the primary focus for the Office of Minority Health is to address the needs and concerns of our racial and ethnic minority populations specifically, but disparate populations, marginalized populations, and we look at it from an opportunity to create equitable opportunities, whether we're working internally with our departments and offices that we have in the Department of Health, or whether we're working with what we call our minority health partners outside of the agency. So we get to do things from programming to policy to some events. So that's it in a nutshell of basically what we get to do day in, day out.
You know, Gleaners has been increasingly focused on not just the quantity of food that we distribute, but we've been focused through our strategic plan and other efforts on the right nutritional variety and mix, and really driving much more healthy, perishable food through the system. So that's one effort, but then there's an effort to also understand all of the neighbors that need our help. We've partnered with Immigrant Welcome Center and International Center and Morales Group and a variety of other players to try to confirm who we should be reaching. So we have that second effort. And then there's this work that's done in partnership with healthcare providers, with hospitals and others at that convergence of hunger and health. What advice might you give, or what knowledge might you share that would help guide those three efforts or others?
You don't want to leave anyone behind. And so when you're involved in the community, especially if you're engaging, like you said, the Immigrant Welcome Center, or if you are engaging a community-based organization or instance to be part of that process, and specifically getting the right foods and different things to people. So how do you make sure that, one, you create an environment, a safe environment, that, hey, it's okay if you need assistance, two, that we're here for you, that we're going to provide you the right thing. And that's kind of what we do at the Office of Minority Health, and then other partners that we have. We try to be a connecting point to where maybe, again, this group may not be at the table, so let's get them at the table and offer those opportunities.
We know this is going to be a long-term learning exercise, and we are actively seeking feedback from those with expertise. So would welcome that from your team. The other effort that's fairly new here is called Voice of Our Neighbor. And that outreach is intended to learn directly from our neighbors in new ways, and through focus groups and direct conversation, and not just assume we know what help our neighbors need. And I don't limit that just to food insecurity, but to those interconnected challenges of poverty. So is there advice that you would share with us, or opportunities around how to think about using food to help reinforce other efforts?
I think it's a good opportunity to, as you had already said, our neighbors, maybe looking at who the neighbors are that can possibly lead you into certain communities, our faith-based organizations, not just churches, but the Sikh population, Muslim population. Because I think when you bring people to the beginning and not as an afterthought, you're going to be far more successful in all these different diverse communities, not just in big metro cities, different things, but smaller towns and communities. And so it's very important just to realize that Indiana continues to ever change, just as the United States continue to change. In order to be successful, I think we're going to continue to have to be willing to have some tough conversations, be willing to address some concerns, some social justice factors and things that are happening, be willing to acknowledge some barriers that exist to food inequities in order for us to be successful.
I loved your answer in terms of how people should think about the challenge and the problem. But I'm hoping maybe we can think about some call to action as well.
I think it's very important that if there's an initiative such as a task force or your local minority health coalitions that exist, there's an Interagency State Council on Black and Minority Health. As I mentioned, there's events that take place that you can be a part of. We have our minority health partners where we meet once a month. And so everything from community-based organization to American Heart to different things where we come together to find out what's going on in the state and how can we support one another? Because I think we have to create a network of support as well too.
Is that something you share on the State Department of Health website, or?
They can contact our office, which is our Office of Minority Health, which you can go to the State Department of Health.
Okay.
And we'd be glad to be that connector.
Okay.
Our partner meetings are the last Tuesday of every month. But it's an opportunity for networking, so where you can find out what is going on.
Excellent. Thank you so much for being here.
Thank you so much for having me. I greatly
And
appreciate it.
I would say Indiana Department of Health has been a phenomenal partner for Gleaners, and nothing tests the strength of a partnership like a pandemic.
Definitely.
And I think our partnership has only grown and improved. So thank you so much for that.
Thank you.